Welcome to the AI Shift, a show looking at the seismic changes happening in healthcare with artificial intelligence at the epicenter. I'm your host, Tom Foley. Join me and my guests as we look at key cultural and policy shifts impacting how providers, payers, and patients connect, as well as how care is being reimagined both for today and for the future. And now, the AI Shift. Welcome. You're listening to the AI Shift. I'm your host, Tom Foley. We have a great guest on today, Dr. Nabil Badr of HendrenAI. Doctor, welcome to the program.
Thank you.
So this is a very interesting episode. We're going to explore the how healthcare organizations can successfully scale digital health and AI, combining practical implementation strategies, effective governance, clinical-centered innovations, and resilient system design and strong alignment between the technical, the executive leadership. Doctor, again, this is going to be a very compelling conversation. Before we get into the meat of the matter, tell the audience a little bit about yourself and a little bit about HendrenAI.
Yeah, thank you. The doctor here is only for a qualifier for a life spent and, of course, a degree in innovation. So my doctorate is not in medical doctor. It's an innovation management PhD. And
Awesome.
That's actually very pertinent to this talk. I spent my life in management of technology and innovation and dealing with adoption of innovation. And this is where AI is at the center of this at the moment. So, and Hendren is actually also a place where you move adoption forward, right? So we're not like shift and replace. We're not a forceful adoption mentality. We are where you want us to be. You want us to be helping people do their work better? Yes. You want us to be helping the people do their work faster? Yes. So this is productivity shift, not necessarily like earth shifting below them.
Interesting. So you recently launched a nationwide digital pharmacy platform. Tell us a little bit about what it takes to roll out such a platform and at scale.
Yeah, thank you. So this was with the previous company. Main challenge was to make sure we get the drugs closer to the patients. And we started way back, few years back, 6 years. There was no really AI at the moment. So we're thinking automation would be the solution. And the people before me in that company built the automation manually, and now we got more intelligence into it. And then, long story short, I added AI on top. It wasn't to displace people, change business model, or do anything so miraculously, but to be more quality oriented, timely oriented, and react quicker. And, given the time, maybe I can develop those ideas on the call.
Yeah, I'm not a believer that AI is a displacement technology, meaning people are going to be losing their jobs, specifically in healthcare. Healthcare has a unique challenge in that it doesn't have enough skilled resources to achieve the job at hand. Coupled with the idea that we have a greater population that are sicker today than yesterday. So if you have less skilled people, but you have a larger population of sicker people, then what can you do to implement the efficiencies that are necessary to ultimately still achieve good quality delivery of care model? It's a combination of 1 + 1 = 3. In that, how do we couple AI with people to ultimately deliver better care? That's really the goal. That's how I see it. That's my approach. Your thoughts?
Yeah, I agree. And let me iterate a little bit on that. Okay, so AI to me is allowing people to use their skill the best. So to your point, yes, we may have an aging population, maybe a population that's not as healthy as it used to be, maybe. But what we do here is we add quality to the skills that people have. So let's just say a nurse or a pharmacist or even a practicing doctor, they're using AI to do their work best, not necessarily to stop working. And
Yeah.
in every field AI is growing. That's the only success factor. It's not replacing people, but because AI has to learn from somewhere, it has to apply the learning from somewhere. And those somewheres are not machines, these are people. So the human at the loop, you hear, right? And all these anecdotes are not nothing. They are actually uh, priming the AI only industry to listen to the people who can use it.
Yeah. I totally agree. So, I mean, that goes along the same narrative of reframing AI in healthcare as an intelligent automation, and it drives clinical adoption rather than a displacement narrative. I think that people that, in my opinion, may either uh, trying to discourage AI for maybe the wrong reasons or maybe a lack of knowledge, and hence the reason, but if truly embraced, it can be a huge differentiator for any delivery of care model for sure.
Yeah,
Thoughts?
I think, yeah, thank you. I think the ambassadors of AI or even the ambassador of the medical field are not sending the right messages. Okay, so my background is engineering. And in engineering, we feel or we think about adaptation, adoption, and how we actually learn through the experience, right? So, first idea, automation. This is, to me, AI is actually the opposite, is IA, right? This is where you mentioned intelligent automation. So, automation, we've been living with automation since almost 100 years. And then we started moving the automation with more feedback loops. And that's what made us more successful because we're learning as we automate. And then came AI. And I think all AI is doing is accelerating the feedback loop. And this is what it should be. So we learn better, we do our thing better, we do it faster, and we do it with more intelligence. Okay, so AI. And intelligent means that the why and the how and the when and the what if is happening as we work. And that's very key.
Yeah, I'm listening to you and your comments, and what came to mind was, in the past in healthcare, you had 5,000 different healthcare systems, as an example. You had 500,000 plus doctors. There really wasn't any guide. How do you deploy an EHR? Everybody, because I come from that early model of paper to meaningful use. So how do you deploy it? And let's remember, 50% of all EHR deployments at the time failed, right? So there was no real single authority on best practices, but everybody had an opinion. The
Yes.
point there, the reason why I raised that is with AI in healthcare, whether it's on the technology side, the operations side, or even the clinical side, AI brings continuity of thought, a single thought, maybe not necessarily a single thought, but it's guided. It's got guardrails around what it says and what it doesn't say. So someone using it can get greater level of consistency in what they get out of the model. Is that fair? Am I off base there? Or what do you think?
I got a little spice to add to that, if you don't mind. Okay.
Go for it.
I would say if you let AI do the work, it will fail because AI is not trained to do the work that it wants to work. It gets lost. Let me backtrack into example. EHR wasn't there, right? So everybody did their best to do with what they have. Their practice, their papers, their faxes, their emails, even at that level. Then AI came, but came disorganized. Now nobody knew how to do anything after that. And I think now with the AI acts here and there, the European Act a couple of years ago, and now it's getting to be more with the risk management framework governing AI in the US. Now we're starting to be alert that if we let this thing alone, it will not work. So to your point, we are adapting AI to what we do. So AI now becomes another language. EHR used to not connect together. Now they're connecting together, but the guardrails have to be defined, and AI is connecting them through those guardrails. Then it works. But if you let it connect them arbitrarily, it will make mistakes. And I'm saying it to, itify the whole world of AI. And now we're getting to a point where we're starting to organize AI, regiment AI. And that's what Hendren is doing, basically, doing verticals using AI that help directly their use case, not random. And you will see in the future, I think within 5 years, I do a lot of research here. So I think within 5 years, people are going to start realizing that AI has to have a reason first, not AI for AI's sake, which is happening around us nowadays. AI
Yeah.
has to have a reason. What do I want to do with AI? And once you define that, you redefine the envelope. If you allow me to have a point on what is happening now, for example, in Rhode Island, I'm just picking that because I think other states have done it, but I just read it this morning. Rhode Island said you cannot use AI, scribe AI, meaning the doctor helper taking notes. You cannot use it without the permission of the patient. Now, this is the first time a doctor cannot do something without the permission of the patient. They have to adapt now. The patient is letting the doctors into their world using AI. Now the doctor has to respond. And what do they do then, the doctors? They go back to their old ways of taking notes. Some of them are asked even not to take notes on the system because the patient is getting nervous. They have to still use paper and pen. So once you put all these three tools now instead of two, right? The EHR, the paper and pen, and add AI, now it's getting complicated on the doctor. And the patient is making the choice. We have to adapt to that. The
You don't
third,
you don't I don't mean to interrupt you. You don't think that the simple idea that, hey, doctor, you should ask the patient because this ambient AI is listening to this conversation and it's going to translate for you, right? A clinical note, right? But this actually got driven, I'm sure, through a lawsuit. I think it was out in California. I could be wrong on the state, but the patient argued that there should have been consent on the recording. So do you think that the patients are resistant to the use of AI in the context of ambient listening so the doctor can pay better attention to what the patient's actually saying versus being a typist, a listener, and a talker all at the same time?
I think they, without knowing, they become worried about their privacy. I've done a lot of research in this and, published a few papers on this. How can a patient allow the doctor to take information without their consent? That's what they say. Being with the doctor, I have my confidence with the doctor. I have my trust in the doctor, and I know this stuff is not going anywhere. When EHR came in and the doctor started typing on the keyboard, there was some resistance too. Okay. Even way back 20 years ago.
Mm-hmm.
Then now, hey, who's listening to me? This ambient listening is they might know I have a certain sickness, and then next day it's gonna be on the street, and I'm not gonna be worried about my job, and the insurance going up, and it's like, whoa, my whole boundary is leaving this doctor's office. So by
Yeah.
doing consent, you're asking the patient accept that boundary change. And the doctors now have a burden because they cannot leave AI do its job. For example, if you want a transcription, and I have a doctor friend of mine who actually did that, now you need to hire actually a medical aid versus reducing staff. If you want to be a doctor who's listening to your patient and not having to take notes, you got to hire somebody because they will be required what the patient says no. So everybody's saying AI is going to make jobs disappear. I'm saying the other way. I'm saying it's going to make work appear in a different way. But all the workers, including AI, will do the job.
So how do you think consumers are embracing this idea of health AI in healthcare? Because you have two sides of the equation. You have the ambient listening side, right? The patient has to physically go to a place where ambient listening is turned on, hypothetically, right? And you have a doctor and a patient conversation taking place, and it's going to scribe a note. That's one model where AI is useful in healthcare. There's plenty of different models where it's useful, but then you have the other use case where the patient's going to come through an AI agent. It's going to handle the entire intake, right? And then the providers present it with this note that says, hey, based on this conversation that the AI engine had with this patient, it's this is your new starting point, right? You don't have to ask all the questions, if you will, that because again, the doctor is so burnt out because they have to do they have to be the listener, they have to be the talker, they have to be the typist, all the same. This is where I think AI, a combination of ambient listening and the AI intake is a very powerful tool. I mean, I can even see ambient AI to some degree being very applicable to a mental health discussion. Patients would certainly have to consent, but what are your thoughts on here? There's a large outreach of where AI can be beneficial to enhance the quality of care. But what are your thoughts on the consumer's ability to adopt it and accept it in order to drive a different pathway?
Yes. Yes. What I hear mostly is who's responsible for mistakes now? Is AI responsible for misrepresenting a patient's diagnosis or conversation to a doctor who's not present at the time? Or is the doctor, relegated his duty or her duty and dependent on technology? This is going to be where I think the culminant point of flattening AI adoption in healthcare.
Yeah.
But to get there, I think, and I always discuss it in the conferences, you have to have a shepherd for AI. You cannot have AI on its own. Why? The shepherd now becomes responsible. Then you might ask, so why AI then? Why just not have the old way? Well, not really, because the old way used to say, I have to be the doctor, always sitting in front of the patient and not assimilating what others might say. Other sources might help me. So what's happening now, it could be just a recording function that is good enough. Could be just the transcriber that's good enough, where I can have this imagination. When the listening of AI while transcribing is actually dipping into data and databases that are trusted, research from 50 years, all kinds of research that was done, and popping in front of this practitioner questions that they might ask, even the psychological side of the story, with the mental health side of the story, and the biological. They say, okay, so maybe somebody, I'm belaboring this, but because I'm going to make a point, maybe some research has just finished with knowledge that if you eat too much chocolate, you might, get Alzheimer. Let's just say the doctor just looking at it will realize that there could be things that were not known are known today. So it actually helps the doctor diagnose right there and then. That's the culminant point, I think, in how AI can help the practice, not replacing quick analytics, temporal data. It's too hot, too cold, this kind of stuff that can help the analysis and the diagnosis. This
Yeah.
is a dream. If I see it before I go to the other world, I'll be happy.
So, you're calling out the idea. Well, first off, you mean, let's take the average Medicare patient with 5 chronic conditions. CMS says
Yes,
they have 9 different doctors, right? It's hard for me to believe that a single doctor, let's use the primary care, and I'm not picking on them, it's just let's use the primary care as the coordinator of care across the community, how they can remember everything about, not only about the patient, but about what's going on in newer care delivery models, as an example.
correct.
This is where AI can bring it together and really be not only an intake engine, not only a note recorder, but an educator. In that, hey,
Mhm.
doctor, did you remember that this patient actually has condition X? Is that really the core of what you're saying, is that is ultimately the core value of AI? Is
Exactly.
do you see AI
And not, I'm
ultimately?
sorry, Tom, it's not
Yeah,
in medicine only.
yeah,
This is going to apply everywhere.
yeah,
Somebody doing their job connected to certain helper machines can help other people or help whatever the engagement is better.
yeah.
So,
So how do you bridge the gap here? You have the technology, and you have C-suite uh,
mhm.
managers that ultimately, there's a gap, right? It's all, AI is cool, right? But how do you bridge the gap and educate C-suite to ultimately create this translate go through this translation gap and ultimately mitigate the derailment of any digital transformation efforts?
Thank you. This is actually what is going to transition us to the next mode. I advise the C-suite to follow the basics of, the business model canvas, right? 2010, it was, launched, and whoa, it was the holy grail, but it was just a summary of the practices from years ago. And the idea is focus on what are the dimensions, what you need, how much you need, when you need it, and who are your partners, how much AI is going to enhance the bottom line. Because without the bottom line, there's no company. So first, you got to think at the bottom line. Okay. While thinking of the other umbrellas, and then when you move it down to however you want to articulate it, above the line, below the line, whatever they do, you got to follow. Am I still maintaining this connection with the canvas? Because the canvas kind of looks at your resources, looks at your customers, he's the patients in healthcare, and the PBMs, the pharmacy benefit management, etc.
Hmm.
All the suite of collaborators, of money makers. All that has to go into the question, the picture, because the C-suite doesn't think all the same. You get the CEOs thinking one way, COO another way, CFO, CTO, CIO. All of them are focused on their egg, right? To make sure it
Hmm.
hatches properly. But what you need is a communication among the C-suite members saying, let's not cheat our mind. Where AI is today has to be where AI is tomorrow in the company so people can adopt it within the company, but it has to add value. So you define the value differently.
Yeah.
It's not an
So
easy answer.
what would you suggest to that executive? Certainly, Hendred AI is certainly a valued resource. Obviously, you represent them. How can what does Hendred AI do in order to
Yeah.
facilitate the a greater awareness of how to go about approaching the adoption of AI to enhance the overall quality of a business?
Key is alignment. If it takes for us to meet every day, we'll meet every day to align. If it takes us to, read from the same book, we will read the same book to align. Because alignment internally brings everything in line externally. So what we've done at Hendren, we all meet all the time, not to waste each other's time. 5 minutes is enough. Where are we? What do you think? Should we? Should not? Should we not? We have the chief revenue officer might say, "Oh, I have this customer that might." Okay, so we'll get together. Say, how much will it be for us to make the lift? Will we make a difference? Would the company be okay to make that shift? And it's even we look at that, and we are parenting AI. We are the ones who are putting AI in places. We have to make sure we align, not to miss a beat.
Interesting. So they can reach you on your website, HendrenAI. So it's HendRen.ai.
Correct.
That's where they can reach you. Dr. Nabil Badr, very much appreciate this conversation. It's been very educational.
Thank you.
Any last words? 30 seconds to close out the discussion.
Thank you for the opportunity, and let us be an advocate of safe adoption. I would say safety for me is doing the right thing for the right person at the right time.
Awesome.
And thank you.
I appreciate that. Have a great day. Thanks for listening. If you missed any part of today's episode, you can tune in at the same time, 11 a.m. or 7 p.m. Eastern throughout the week. Be sure to check out the program page on healthcarenowradio.com, and remember to connect or follow me on LinkedIn, X, formerly Twitter, @FoleyTom, and follow the show's hashtag, The AI Shift. I'm Tom Foley. Until the next shift.